The subject of heart disease dominates our health news. Statistics show more than 33% of deaths in America were the result of heart disease. Here in Houston, we met with Dr. Kota-Reddy, cardiologist and founder of Reddy Cardiac Wellness, who talks with us about the importance of diet for your heart health.
What is the cause for heart disease? It's what you eat. Most people are concerned about genetics. The answer is genetics does not cause heart disease unless you have the bad diet. Then the next question is, what is it that I'm eating that causes heart disease? Is it sugar? Is it starch? Is it bad fat? It's actually a combination of sugar, starch and bad fat. When you consume a lot of starch, it kills your good cholesterol. When you consume a lot of bad fat, it raises your bad cholesterol. When you combine the two, what happens? Your good cholesterol drops, your bad cholesterol goes up, you end up with obesity, high blood pressure, diabetes and heart disease. So what is the best way to prevent heart disease? Change your diet. If you were to avoid sugar and starch and decrease saturated fat, what are the chances of you having low good cholesterol and high bad cholesterol? It doesn't happen. Most people are concerned about cholesterol in the food. If you eat cholesterol, only 20% of it is absorbed. 80% is not. For example, take an egg. Most people shun an egg because egg is high in cholesterol. But there was a study done in Japan where they looked at 100,000 people for a year who were consuming more than 14 eggs a week, that is 2 or more egg a day. In 1 year, they found that their cholesterol did not go up. That also explains why vegetarians who never have any cholesterol in their diet have high cholesterol. Why? Sugar, starch and bad fat. For example, pizza, starch and bad fat. Desserts, sugar and bad fat. Everything man-made, sugar, starch and bad fat leads to heart disease. If you want to reverse heart disease, what do you need to do? Change the diet and get on medications. If you want to prevent heart disease, what do you do? Change your diet. If you have genetic factors, there are certain blood tests you can do to find out if you have genetic factors. If you do have it and your cholesterol numbers are still abnormal, then go on medications. But if you combine diet with medications at any stage in life, you can stop heart disease, you can prevent heart disease, you can reverse heart disease. So everything and anything you eat should not have sugar, starch and bad fat. So 80-20 rule. 80% of the time, whatever you eat should be non-starchy vegetables, sprouts, avocados, tomatoes, lime, lemon, cucumbers, nuts, except cashews and pistachios. Why? Cashews and pistachios give you a lot of sugar. 20% of the time, eggs with yolk and any lean meat, beef, buffalo, pork, sheep, venison, duck, chicken, turkey, goat, anything lean. I do recommend fish, but I don't recommend fish every day. The reason being, we don't know where the fish is coming from and we don't know what is the content of its pollutants like mercury and PCB. So it's a simple diet. For a lack of a better name, I call it a ready diet. So go on an 80-20 schedule, vegetables, lean meat. And I also came up with the bread. My first patient on the bread and diet lost 110 pounds without exercise in less than 6 months. There are a lot of other patients who have dropped their weight. A lot of patients have dropped their weight and controlled their blood pressure without medications. A lot of patients who are diabetics have been taking this bread with my diet and their blood sugars have normalized. So if you go on the diet and if you replace the bread with my bread, what are the chances of you having obesity? It doesn't happen. What is the chance of your blood sugar going up? It doesn't happen. So that's a simple way of saying, what is a diet? Ready diet and ready bread. Exercise is good for conditioning. Exercise is good for building muscle and bone, but exercise is not good for preventing and reversing heart disease if you do not change your diet. So the moral of the story is, when you go buy beef, what do you look for? Does this beef have a lot of fat? Is it marbled fat? Why does a beef meat have marbling? Because you've been feeding grains to the cows. Let's say when your grandfather butchered a cow, did he have marbling? No. Why? It was grass-fed. Well, if that's what is happening to the animals, what's happening to you and I? We are eating grains, we are eating cereals, we are eating fruits, we are eating chips, cookies, crackers, pasta, bread, rice. So when you eat a lot of sugar and starch, you're forming fat. What type of fat are you forming? You're forming bad fat. And is that same as marbling? So imagine if an alien were to come down, what would he say? Don't eat Texans. They have a lot of marbled fat. Not good for your cholesterol.